So now we want to bring our conversation back into research. Our friends from the KEMRI Wellcome research program back in the studio. This time we have the head of engagement, Noni Mumba, who's our guest. We are going to talk about what? About research ethics. So research involves dealing with the community. When you go to the community, there are certain expectations of the research, and there's expectation or zero expectation understanding by community. So how do you deal with those ones, and how do you make sure that this relationship is actually a good one? This is what CT teaches on his private time, and he'll definitely tell us one or two things about it, and then Noni will. Noni, good morning.
Good morning, Eric.
Welcome to Kenya's biggest conversation.
Thank you.
The hot seat of the Situation Room. How is it?
It doesn't feel so hot, but I'm happy to be here. It's a real pleasure and a real honor. I'm looking forward to excellent and nice conversations with you and the rest of Kenya.
As always,
yes.
That's what we have here every morning.
Yeah.
Noni, let's talk about research ethics, and this is what you deal with on a daily basis at the KEMRI Wellcome Trust research program. So what is it that you do as head of engagement?
Good question. So my work at what we call the program, so when we talk about KEMRI Wellcome Trust, we just call it the program. So my work in Kilifi revolves around coordinating the development, thinking through what kind of activities can we do, like in a nutshell, that bring researchers and community members and stakeholders, Ministry of Health together to have conversations about the research that is really important, is being undertaken, is being planned. In a nutshell.
In a nutshell.
Yeah, just creating activities, talking about them and making sure those activities are there, they're happening, and we monitor how they happen, make changes where changes need. So that's my work. And I work with a team, so I supervise that team as well.
Why is it important to bring stakeholders together at the onset of a project? Why do you have to bring the researchers and the community and the other stakeholders, government, NGOs and all together?
So research is really important. My colleague who was here before, Professor Sam Kinyanjui, talked about how research is a tool that enables the development of things that are important for humans, either medicine or other kind of interventions. So it's important to bring all the so all these stakeholders that we're talking about have an expectation or have an interest in research that is being planned or is being implemented. And so it's important to bring them right from the start into a table to be able to discuss what are the priorities, why are we asking, why is this question important to answer, what do we want to find out, and for the communities, how will it benefit us? What are you exactly going to do? So sort of like getting them into the room to discuss all of that, because research is really important and it can't be put aside and just be done by the scientists by themselves. All these stakeholders need to come onto the table to be able to discuss these really important things.
Why must they discuss these important things? Why can't they just be told, and then we hope against all hope that they will understand what they've been told and thereafter implement what they have been told?
It's about them. I mean, the basic things of life is that research, for example, happens in people. So a research is conducted on people. You are either going to answer some questions, you're going to have some samples taken from you, so you need to have an interest because it will impact you anyway. If it is not the individual being impacted, it is the health systems that will be impacted by this scientist who is developing an intervention or is answering a question that is going to change how things are done, for example, in a hospital or in a health setting. So it's important for people to be interested because it will impact their lives anyway, in one way or another.
Yeah. Sure. So even as we have the discussion talking about ethics, already coming from the premise that, ethics are about what you should or should not do.
Yes.
The lines within which you can or cannot color. So when it comes to research, one would think this is a good thing. We're doing research, we're finding out, solutions to problems. In this case, health-wise. So what are some of the boundaries then you start to look at? What are some of the research ethics that you then bind or are bound by?
So when you're thinking about research that takes place amongst human participants, human volunteers, somebody is going to come and volunteer their time, perhaps even their body, for you to be able to conduct a clinical trial, test a drug or test a vaccine. So some of the things that are binding, or they bind these researchers, they have to abide by things like, so there are three key things actually. One is respecting these individuals, respecting this person who is going to participate in the research. And how do you demonstrate that you respect this person? You have to give them adequate information. The information has to be in a language that they can understand. And you have to respect that they have the right to agree to participate, and they can withdraw from that research at any particular time. So that's one key thing, respecting these individuals and demonstrating that respect by providing for them information and then allowing them to make an independent decision. And even when they join the research, they should know that they can come out without any consequences. The second really important thing that researchers are bound by is something we call beneficence, or the ethics guidelines called beneficence. And in simple terms, what that means is, are there any harms that are going to come out of this research? How can they be minimized so that this individual who is participating in the research does not get harmed? Is this person going to get into their pocket? Are they going to undergo any costs to participate in this research? And how are you going to sort that out? If it is something like a drug trial or a vaccine trial, how are you going to cater for the medical costs of this person once you have given them that interview? So that's a second thing. The third thing that binds scientists is something that is called justice. And justice simply means, is this research going to benefit that population that you're implementing or conducting the research on? How are they benefiting from it? Are you giving people a fair chance of being able to participate in research? Are you making it open, or are you hand-picking some select people and you keep going back to those ones for one reason or another? So basically those three things really bind scientists.
Maybe I can take you a step then, just a few steps back. Why was it necessary then to institute research ethics? Because obviously sometimes when you look at any kind of regulation, it meant that things had gone haywire at some point. So why was it necessary to have this done?
Going back now to my research ethics class or training. So indeed, when you look at science and people wanting to discover things, there can be a tendency for people to manipulate, to exploit, and especially in settings where we have people who we can call vulnerable. Maybe their literacy levels are low. They may not be able to understand all this scientific jargon. So in the past, many years back, there were what we call atrocities that happened. Scientists would experiment on humans, and they would not give them an opportunity to opt out, for example. They would not give them any information, and they would conduct really bad experiments. For example, freezing somebody's limbs just to find out, how long can a limb stay frozen, and or have a
lobotomy with no anesthesia.
Stuff like that. So
the person is alive, by the way.
Yes. Yeah. So there are these atrocities that happened in the past, and of course people came out in arms about them. Both people, the experts. A lot of these were being done by medics or medical fraternity. So people came up in arms, and some of these were taken, to court. Some were jailed, and then guidelines now were developed to say how then can we, because research is important, we still need to do research, but how can it be done in a manner that these humans are going to be protected?
And are there fine lines? Because I think in some of the atrocities that you think about, and many, not too long ago, we had people, usually of black persuasion, who were injected with syphilis. to see how they were going to react. But today we have vaccines and we're doing the exact same thing, isn't it? We're injecting people with the disease. What's the difference then between the two when we're looking at ethical lines?
So there are fine lines. The difference would be that, as I've said, this person is going to be given information. However, before this particular product is injected in a human, there will already be tests that will have been done. So this researcher has to prove that this product that I'm injecting into this person has a certain percentage of safety that is acceptable. It has undergone thorough testing before, either in the lab and then amongst some animal, and then perhaps in a first human and maybe 2 other humans, and it has been seen to be safe. So all of that needs to there has to be that testing has to happen, and then there has to be a group of people, experts, who understand these things, who will also review all that data that comes out of all these tests, who can say this is safe to be able to go on. And then, of course, the key thing is people are not forced. And then there's many other things that have been put in place to ensure that a person has recourse. So if at all this drug, for example, or vaccine is tested, or this thing is injected and somebody gets harmed, there's insurance. There's the researcher has due diligence to be able to cater for the care of this person for as long as it is proven that they have been harmed by this product. Yeah.
It's difficult work, isn't it?
Very difficult. And more difficult to explain it to the community.
But then that brings us then to the question is, when you have research scientists, researchers who are involved in research that involves human subjects, how then do we ensure that they are well trained to be able to accomplish this really difficult and sensitive task? Understanding the needs of the community, communicating this scientific message in a language that can be understood, and then how then do they determine that it has been understood? And how do we also get the community to understand that beyond participating, they're actually partners in the process, because without them, this process will actually be dead before it even actually begins. Again, a complex situation.
Absolutely.
Yes.
So you've asked 2 things: how the scientists are prepared in terms of training, and then you've asked how does the community come in terms of them understanding about their own role. So I'll start with the first one. So the preparation of the scientists starts way early, especially now, in line with enabling them to understand their role in helping community members or research participants to understand research. I'll give an example of our program. And what we do is, which again, Sam Kinyanjui spoke about, we begin to engage very early, like even at primary school level. We are beginning to talk to young people about science. We are beginning to show people that it is important to respect research participants. If a scientist approaches you as a research participant, they have to show that they respect you by doing certain things. And that goes up to secondary school, to people who are in graduate school, they're doing their bachelor's. When they come into our program, for example, at KEMRI Wellcome Trust, where we have internship programs and then master's programs and then PhD programs, they are these students who are learning to become researchers. They are in an environment where we have already established systems that show that you must respect the community. And so we begin to train them that way. They participate in discussions where we are talking about how do we engage our community members. As an engagement team, myself, together with my colleagues, we have seminars, we have meetings, we have in-house what we call exhibitions, where we talk to our research staff on the importance of engaging the population. On the community side, we go out to the community. We have community barazas, we have our community meetings, we invite community members into our facilities. And we do that not only to help them to understand what research is, but also to help them understand these three things that we've spoken about. Respect for persons. Are you benefiting? Is this research going to harm you? Is there justice? To understand those key three things, so that then they can understand that they have a role to play. Their opinions are important. They are not just subjects on the receiving end of a scientist's needle and whatever else. That it's important for them to also share their opinions and be open about what they want to see happen and what they don't want to see happen.
How do you get the participants to understand that when they are participating in a study, they haven't been employed?
Again, talking to them. So all these structures that we have put in place in terms of activities that we hold in the research program, we explain what is research, and when you're participating in research, what is research and what is employment and what is the difference. Of course, there are things, Muga, like payment. So when a community member is participating,
you have preempted my thoughts exactly.
There's payment, so they'll receive a payment. So we have an explanation. We use the information sheet that I talked about when I said when you're demonstrating respect for persons, you have to give them information. So we have an elaborate template that explains the research that this community member is joining in. And there are sections in that template that talk about what exactly are you getting into and what is owed to you. What are you going to get out of it? So we basically let them know that if you travel to a research site, we have to reimburse your bus fare or taxi fare or whatever. And because we will have taken your time, maybe you'd have gone off to do what in Kenya we call here akibarua, casual labor work. You would have gotten something out of that. So because we have taken you away from that, then we have to compensate you. So it's not employment, but that's a language that we use. In Swahili, we use tunakuregeshea. So we are just reimbursing you. We are paying back what you would have earned. So it's not that is an employment that someone has gotten.
Does that all those things that you've explained?
Yes.
Is that how the beneficiary or the research participant actually understands it? Tunakuregeshea, tunakulipia, tunakunini.
Yes.
Does it all come out as you're paying me for it? I mean, just think about whatever. Even in a formal company such as this one,
yes,
when there's reimbursement for whatever per DM,
yes,
is it payment or is it reimbursement?
So when it is
in people's understanding,
it is a payment.
There you go.
But we also have to make them understand what type of a payment and what is the payment for. So in as much as the community member will feel like this is a payment, I'm being given a payment, we have to go to those lengths of explaining, but why are we paying you?
Sure. Does it hurt if you I'm sorry. Does it hurt then if you're looking at the general guidelines or the parameters of the research, even now as we look at the ethics of it, does it then hurt if you don't? Because communication is not just one way.
Yeah.
Communication, it's a full definition, is that I communicate something to you. It's only complete if there's an understanding and there's feedback. So does it then hurt the ethical guidelines within which you operate if the participants in the research do not understand that I'm not coming here to be injected with the placebo or whatever for payment, but it is that I'm taking my time out that I would have used to do something else, and they're saying, okay, well, thank you for participating in this, let us reimburse you. If they don't understand that, does it then, does it shade on those ethical lines?
It does to an extent. I don't know whether I would use the word hurt, but it diminishes that ethical conduct
or the integrity of the research.
The integrity. If somebody feels like I'm being paid, and indeed in the past we have had people who have said, "Ninalipwa, I am being paid," but that's why we have this engagement platform,
Right.
because we are continuously trying to build the understanding in this population that it is, you see it as a payment, but in actual fact,
It is not.
It is not a payment. It is compensating you for
For-
the time that you have taken to participate. And a good number of community members actually understand that. But you'll have the odd person who will say, nimelipwa or ninalipwa, or sometimes even a journalist saying, get paid for participating
Yes.
in this research.
You
So
could argue the same way.
Yeah.
I mean, politicians, out of the kindness of their own heart, reimburse people for transport for coming to their meetings and their rallies. And the people understand it as such.
as payment.
No, as reimbursement for taking their time for coming to
A standing allowance.
This politicians meeting. I mean, nobody even looks at it as a payment or bribery. No. As Kenyans,
Yeah.
when a politician says that you've come for my meeting, so shika hii 500 kila mtu lunch, I understand it as that. Ni lunch too. Si malipo. Let's take a break.
This is the Situation Room, the only way to start your day.
Trials, for example. And so all these guidelines, what happens is at, for example, national level, countries or the bodies at national level that are responsible for research conduct take all these guidelines and then contextualize them, make them suitable for the local context, and so develop country-specific ethics and scientific guidelines that then researchers operating in that particular country are supposed to follow. Then, as I've said, right at the local level, there are committees that have been set up. So at KEMRI Wellcome, for example, we have a local institutional committee of experts. So when a scientist develops their research protocol or what we call a research proposal, it is interrogated thoroughly by like-minded experts who are removed from that research. They're not part and parcel of that research. And so they interrogate the science, the scientific procedures that are going to be there, that are going to be conducted on the people, including even if it's just questions. And as an engagement team, we also look at those research protocols to interrogate how are you communicating this information? Have you included all the information that you've talked about in the proposal in this information sheet that is going to go to the person? And that goes all the way to national level. So those things are looked at even at the national level. We have a body under the Ministry, I think, of Science and Technology called NACOSTI. And NACOSTI looks at all the research that is being implemented. But we also have, as Kenya Medical Research Institute, we have a scientific and ethics review unit that looks at all these protocols. Hospitals, universities that have research work being undertaken in those hospitals, like Kenyatta National Hospital, will have a scientific and ethics committee that reviews research which is happening within Kenyatta National Hospital. The same with people like Jaramogi Oginga Odinga, Coast Referral Teaching Hospital in Mombasa. They would have their own internal ethics body that when a researcher brings a protocol, they read it page to page.
So this sounds like they're doing it at that beginning stage.
Yes.
At the point of implementation, at the point of research,
Yes.
who comes to the ground to make sure that all these things that you put on paper are actually being implemented and followed?
So these research committees themselves are supposed to, from time to time, come down to the ground to do their own audits or to do their own monitoring. And internally, even research institutions, we have our own, for example, what we call monitors, especially for clinical trials. And the work of monitors is to do their own internal, the way an organization can have an internal audit system. I worked in my past life for Population Services International, and they had their own internal audit group of people who would randomly pick files and look at, how a payment's being made, who has eaten money, and so on and so forth.
Okay.
So it's the same thing. So these monitors, it's true, Muga. So these monitors go and pick like a random file of a clinical trial that's maybe it's a vaccine trial. They go pick a random file and they flip through, for example, the informed consent sheets. Have they been signed? Do they demonstrate that this information was given to a research participant and they signed, certain things? So there are those processes in place at the national level, institutional level, where people actually audit and monitor what is happening.
Do the monitors go to the community to find out, to gauge their understanding of this thing that they signed? You know, those things we were talking about. Do they understand that this was just a transport reimbursement and not a payment? Do they understand that just by coming here, or what you're doing is you have actually volunteered your time and goodwill to participate in this and not unemployment? Do they go to understand how much effort the researcher has actually taken to explain this thing on paper to the community, and has the community understood it as such?
Now that's our work. The monitors do the monitoring at the institutional level. Our work as an engagement team, working with the social scientists whom we are in the same department, do now that work. So we conduct research, what we call qualitative research. We conduct focus group discussions or even in-depth interviews, and we could be answering that question, that do community members understand these contents? And some of those conversations have led now to us developing very clear and very simple information sheets that are now being used in our research institution for relaying information, because we've sat with community members to gauge their understanding of what do you understand by compensation, what language would be appropriate for you to be able to understand some of these things. So we do that social science work, we get findings, and then we share those findings with the scientists, either through a seminar or sometimes even through a publication, to let them know that we need to improve on our communication. We need to change how we need to train even our research staff on how they are communicating research terminologies to the community members.
There's a bit of a problem here.
Yes.
And this problem is threefold. One, research, medical research that involves human beings is most often conducted among poor people. Now, unfortunately, poverty comes with vulnerability.
Yeah.
So, any amount of money that you give as reimbursement, you can twist it as much as you like, it will, because of the impact it makes on a person's life, you see, they will interpret that money in terms of what it does for them, not in terms of what we say. So, is it that our model for conducting research needs perhaps retweaking and relooking into? Or is it that because, say, a country like Kenya, the vast majority of people are poor, and so when you conduct research among people who are economically disadvantaged, you are actually getting the pulse of the nation, so to speak. Now, second point, because of the aforementioned, you then have a situation where, if you're Kenyan, you will understand. Somebody will look for opportunities to participate in a study because it promises them something that ordinarily they would not get. Now, that will have a direct influence on what it is that this individual responds to and how they respond. It may not be adverse, but there'll be a response. Now, if research is conducted among a certain population over a period of time, people get to the point where they now have an understanding of research. Again, now this is the problem. Then they get professional about it, because there is this little element of what we researchers will want to call reimbursement, but them, they know it's payday.
Yeah.
You join this research, and with the time, you talk about focus group discussion, they will have their own focus group discussions in the community when you're not involved. And they'll even know how to respond to these questions that you think you're going to ask them. So they, just like the research scientists are professionals, the community then become professional research participants.
True.
Okay. I think you know I'm going with this one.
I think so. I don't know whether you want me to respond now or you want to continue.
want you to respond.
Just go there first.
Yes.
So that all of us can be there with you.
I think Muga,
Let him ask the question.
Okay.
No.
Siti, ask the question.
She's got it. She has got it.
Okay.
She has got it.
Yeah. I think you're right in that, research is, there's research that is conducted in low and middle income countries where people are what you would call vulnerable. They are poor. And because they are poor, they are also probably hardest hit by health problems or health issues. They have limited access, for example, to healthcare. They are prone to getting infections a lot of times. So in Kilifi, for example, if I give an example of Kilifi, by the time the research center was being set up, deaths of children under 5 caused by malaria were very high. So obviously the research that is going there is not just being taken there like maybe to exploit these people because they are poor, they are vulnerable. It's actually going to help. Now, over time, are people becoming professional participants of research? And we have conducted, as I said, we conduct social science studies, and we have conducted social science studies to look at when somebody is joining a research, what are they thinking about? And they are, to be very honest, they are thinking about, what will I get out of it? I'll participate, but what will I get out of it? So we can't run, those are realities of life. Somebody would have gone somewhere and they would have gotten some money, but then they're participating in this research where they don't have to do back-breaking work. Of carrying cement and whatnot. They just have to visit a clinic and have 2 ml blood removed from their arm, and then they go home and they get their days, what they would have earned. So we cannot run away from the reality of the fact that some people are in it for the money, but there's also people who are in it because they actually feel, and we have had community members saying, I want even to be given a certificate to show that I participated in this research, because I have not only helped myself, I have helped my community, and I have helped even just the world, because I have participated in this research, and I'm going to help the scientists to get an answer to the question that they are asking. Yeah. So in a nutshell, you are right.
Some long-term research projects, Noni.
Yeah.
Like when we visited Kilifi, we saw the epilepsy program.
Yes.
Right. That's a long-term project.
Yes.
And it involves people who actually have the condition of epilepsy coming to the facility every so often. But as they're doing this, the researchers are gaining data from them. There's the other project that we visited,
Sickle cell.
the sickle cell, right? Same, long term. Do those people, how do you explain to them, I mean, I am unwell and I am coming to the facility, and as far as I'm concerned, I'm coming to this facility because I'm getting help. But at the same time, I'm subject for research. How do you explain that to the person?
So in our engagement activities, the various kinds of engagement activities that we conduct, when we do community barazas, when we invite community members into our premises to take them around the laboratories, we are exposing them to research, and we are explaining to them that our main mandate, we are not a hospital, our main mandate is research. And so as a community member, when you come into the sickle cell clinic or you come into the epilepsy clinic, you are coming in as a research participant. However, the researcher has is required to offer also medical assistance. So we run our epilepsy clinic and our sickle cell clinic both as research clinics, but also as clinics where people just come to access care. But through our engagement activities, we are out in the community most of the time, apart from when COVID was happening, and we're explaining to people that our mandate is research. Do they understand that very well? Perhaps not so much. There are some who understand, there are some who don't understand. But our work as an engagement team is just to continue passing on that information, that our mandate, we are not a hospital. But people would get that confusion, because apart from the sickle cell clinic and the epilepsy clinic, our scientists who are medics also see patients. They do ward rounds in Kilifi County Hospital, and they're wearing a KEMRI Wellcome Trust, badge. And so when you go to the population, they will say, do you have a patient? Take them to KEMRI. They mean take them to Kilifi County Hospital, but when they get into the ward, they'll see a medic, maybe in a lab coat or maybe not in a lab coat, but they're wearing a tag and they have that file and they're taking vitals and so on and so forth. So there is that, we acknowledge that there is that confusion between research and medical care, but our work as an engagement team is through these platforms like radio, like the community activities that we do, all these events that we have in terms of engagement, is to continue passing on that information.
But Noni,
that our mandate is research.
Is it really confusion? Because sometimes our interpretation of confusion is what the community is explaining to you is how they understand it.
Yes.
And the understanding is based on, as I said, the impact that intervention has on them.
Yes.
So that interpretation is actually important. Now, that's one. Two, on the subject of reimbursement, ethical review boards have this view, I don't know whether they've changed it, that if you reimburse anything above 100, it's coercive, 100 shillings that is. My question is, why not give them 2,000? Why not give them money that can actually help them? Because if you give someone 2,000 shillings in the rural area, believe me,
you've sorted a lot.
You've sorted out very many things.
But what are you reimbursing there?
No, you are reimbursing.
But are we're quantifying time from 8 a.m. up to 4 p.m. We're quantifying transport.
Yes. I am saying that it's a subject that needs to be debated.
It is.
Because even when people say that they're coming for the money, so what? What is wrong with them coming for the money? Are we saying there's a direct correlation between someone coming for the money and the information they give you? I'm simply saying the ethical issues around the participants, and given the socioeconomic disadvantages and just given where they come from, okay? And if you measure that against the understanding of research scientist, somebody who's involved in research, to marry it, at some level, we need to understand seriously and literally where this participant is coming from and see it from their point of view. Yes. What does 200 do for you? What does 500 do for you? What does 1,000 shillings do for you? What does 2,000 shillings do for you? I'm not saying go and give everybody 2,000 shillings. I'm simply saying
open it up for debate.
Yes, open it up for discussion and have a wholesome discussion where even the subject of coercion is discussed.
I hope they're listening to you.
At what point does it become coercion?
You see, there is this tricky bit where, and the ethical review boards are right. If you pay a certain amount of money, then essentially you're enticing this person and it's no longer voluntary.
There's also a word I want you to add to that, which is exploitation.
Yes.
Because there's potential for scientists to exploit this, what we are calling vulnerable people.
Yes.
Because you can just, throw money at these people and they won't care about the risk.
Because they're looking at the money.
Yeah. So it's a big debate, Muga.
But Noni, you know where I'm coming from?
Yes.
That vulnerable group, 50 bob is coercive. 100 shillings is coercive.
Right.
Anything from zero.
Right.
Yes, it's coercive. So why peg it to 200 or 300? Why just
it's
not?
It's a big debate.
Yes.
Why not make it worthwhile?
Yeah, precisely.
Okay. But there'd be other checks and balances, just besides the money. If the researcher has come and given, I understand. So this is your life. These are your needs. If I gave you this much, this is how much you'd benefit from it. But the researcher still follows the other ethical values that they are supposed to. Says that's okay. I mean, would it only be exploitative because of money?
No. So, beyond the money, of course, there are many other things that need to be, somebody needs to guard against, in addition to ensuring that somebody is not getting into their own pocket. So I've talked about medical care, for example. So even medical care can be coercive. So when somebody is going to be screened and get a full body check, liver function test, is your kidney working?
For free.
For free. And this is something which, when they go to Aga Khan Hospital, they'll pay through the nose to do. Yeah, so there's many things that when you look at them, they could be looked at as coercion, but it's a requirement. Ethics binds you to be able to do that before you actually say, I'm picking this person to participate in my research.
Over and above all of this, have you found, I mean, just looking at the length and breadth of the research that, KEMRI does, I mean, Kilifi being, big spot, but then also around the country, have you found that more, I mean, I don't know how you answer this, have you found that more or less you've been able to keep within the lines of the ethical requirements of research across board, whether it's dealing with children, whether it's dealing with, vulnerable in other areas? Have you found that the research has more or less kept within these requirements?
I can say to a very big extent, yes. Maybe I would be asked, how do you measure that?
Yes.
But it goes by, how many concerns, for example, come to us from community members when we are implementing research activities, when audits are conducted, when monitors visit, and the monitor, as I said, are internal. Sometimes we get even external monitors. When they come to do their audits, what do they find? Do they find that we are actually adhering to these rules and regulations, these guidelines that are out there, or do they pick out? So quite often we have been, marked well, if I can use that word, in terms of how we conduct our research. But it is because we have made deliberate steps to ensure that through our engagement platform and the engagement activities that we are conducting, community members have a basic understanding of what is my right as a person, as I'm participating in research, and the researcher also, on the other hand, has an understanding of what are community members' concerns, what do we need to make sure that is available and is done to make sure that our research is conducted in an ethical manner. Yeah.
And have you ever had to abandon a project because it was going to fault on the research requirements? Not that I know of. I joined KEMRI in 2013. From that time to date, I have not heard of. But so what I can say is, at the institutional review board, the internal review board, sometimes a scientist will come with a proposal and say, I want to conduct this research. And then they'll be asked by these other experts, but why do you want to get more blood samples from community members? And we already have samples in the lab. So rather than take community members into trouble of this, we do have some samples that can answer your question. So in that case, yes, we have had research that sometimes a scientist comes and they are told, no, use stored samples. Sometimes at the institutional level, it will pass. When it gets to the national level, it will be brought back. Yes. Yeah.
Noni, thank you very much for joining us.
Thank you for having me.
Ukirudi Kilifi, wasalimie sana watu wa Kilifi.
Asante sana.
Tafadhali spend a day, visit our friends in Magarini. They've been complaining hakuna mvua, waambie usijali.
In my other life, I'm a reverend, so of the Anglican Church of Kenya. So nitawaombea. Nitawatembelea kisha nitawaombea. Yes.
We are hoping that from tomorrow, mid-March,
rains will come.
Rains will come.
Amen to that.
Thank you very much.
Thank you.
Noni Mumba is the head of engagement at the KEMRI Wellcome Trust Research Program. Keep it here for more. Good